And another myth that I hear, that I have a personal reaction to, is that CBT can only be used in a clinical setting by people who have extensive clinical training. At Beck Institute, and I've personally trained people who are teachers, counselors, human resource workers, supervisors in manufacturing plants, and there's a whole array of things from the CBT model that we have to offer them. We can help the human service workers who come to us, who are working with other people or who supervise other people, help people to resolve problems, help people to make decisions, even teaching them some calming techniques and helping them to accept things that they can't change. There's a whole variety of things, techniques that we have within CBT that we have taught to people in all walks of life who work with other people in those same walks in life and who can benefit from the research and the techniques that we use in clinical settings in just a whole wide range of settings with a wide range of people.
You know, another example of that is what our recovery-oriented cognitive therapy team at the Beck Institute does. In addition to training psychiatrists, psychologists, nurses, and other staff in psychiatric units with lesser training, they also have a program to train peer specialists. Now, these are people with the lived experience of having a condition such as schizophrenia or bipolar disorder, who get specially trained so that they can counsel other people with serious mental health conditions.
Yeah, that's an excellent example, and the opposite of what you would expect or what would be true if CBT can only be done by expert clinicians in a clinical setting, then there could be no training for peer specialists.
Right.
I worked in health psychology for a spell in which I was in primary care physician offices with psychiatric nurses and physicians as well. And these very same tools were even useful for physicians seeing a patient. We saw people who were diagnosed with chronic pain, chronic asthma, heart disease, positive HIV status, and these very same tools are useful in the medical office with primary care physicians and nurses interviewing their patients.
Norman, do you remember our study was in either the late 80s or the early 90s where we trained a large number of nurses in Philadelphia who worked in nurse-run primary care settings.
Yes.
And what they found was not only did CBT techniques help their medical patients, but also reduce their own burnout.
Yes, useful for self-care as well, definitely.
Yeah, and talking about studies, there's been a lot of research showing, like especially in poorer countries where they don't have access to good mental health professionals, they've trained lay people and found that that actually is an effective treatment.
Yeah.